Now, Washington Mornings on the Mall.
105.9 FM.
And AM 630.
WMAL.
6:07 on a Friday morning here in Washington. Brian Neiman, Sherry Jacobus in for Brian Wilson this morning. Thanks for coming in, Sherry.
Hey, great to be here. Thanks.
Great to have you. We'll get back into the war on women that apparently is a faux war now. And the 7 o'clock hour, Jake Tapper and Marie Osmond coming up in the 8 o'clock hour. Very excited about that. Peter Morici's on the line right now, University of Maryland economist. Doctor? You're a doctor, right?
Yeah, I got all that stuff.
Okay, just making sure.
37, 38 years ago, I got a PhD.
Fantastic.
They were on the trial. That was when they were just trying them out.
Right. All right, so last time we had you on 2 weeks ago, and I know that you are not a big fan of Paul Ryan's. And we said we're going to give you some time, carve out some time for Peter Morici to explain himself on why he doesn't like the Ryan budget and why he doesn't like Paul Ryan. So have at it, Dr. Morici.
I don't dislike Paul Ryan. Let's be clear.
Okay.
He's a good guy who's trying very hard. But I don't like his proposals on health care at all. The basic problem in the United States is the prices are too high. We pay twice as much as the Germans for care that's not as good on a per-patient basis. Essentially, his Medicare proposal would be a voucher program. He'd help old folks buy insurance.
Mm-hmm.
And with Medicaid, he'd simply give block grants to the states and say, you figure it out. That doesn't solve the pricing problem. And, there's a lot of sophistry out there. This notion of, we need, if the insurance companies can compete across state lines, all of a sudden healthcare prices will fall. The reality is the big insurance companies are operating in multiple states, and they do compete for big policyholders like the University of Maryland and so forth. And the prices still don't fall. All systems, to some measure and in some degree, regulate prices and ration. Ours does so badly. That's what Republicans can't come to Jesus about, and until they do, there'll be no solution. I'm not enamored by the president's program at all. I mean, it just throws subsidies on top of a broken system, so it'll make those prices worse. But I don't see Mr. Ryan as having real solutions.
But his plan would set up exchanges, right, which the health plans, they would compete. I mean, that's his whole message or his belief that they would compete. And it also sounded like in interviews that I've heard from him that he thought that there would be a chance for some kind of means testing when it comes to both Social Security and Medicare. Well,
all that means testing does is provide another source of revenue for the broken system. It requires the wealthy to chip in some more money
right.
after having paid royally for it through their Medicaid taxes all their working years. So I don't see that as any solution at all.
But if the Republicans are for that, see, this is what I always thought when it comes to means testings for Social Security or for Medicare. I mean, if Republicans are for that, saying, hey, if you can afford it, if you're wealthy enough to afford that, then you're not going to get the benefits from it. Democrats have to be in favor of that, don't they? Since they always want to tax the rich.
Two comments. First of all, the Democrats don't have a monopoly on dumb ideas. The Republicans have some too.
Fair enough.
And second of all, this is a year divisible by 4, so you can't expect the Republicans to put anything forward that the Democrats won't trash. They'll say, well, the Republicans want to take away your Social Security. That's just absolutely claptrap. So my feeling is no, these are broken proposals.
Hey, Peter, tell me something you like about the Ryan plan that maybe the Obamacare plan doesn't have.
I can't think of anything.
You can't think of anything. So
now that doesn't mean there isn't anything I'd like. I'd have to go back in there and wade through all the pages and all that. All right, but I mean, in terms of the basic framework of the proposals, I don't like them very well. And insurance exchanges, they'll be helpful, but they won't lower prices. After all, Ford and General Motors and Chrysler competed against each other, but that didn't keep them from being high-cost operations until they went bankrupt. We never let the health insurance system go bankrupt because we always find more ways to pour more money on it. Like in the state of Maryland, they're going to try to increase taxes just to pay for rising Medicaid costs instead of trying to come to grips with them.
But it sounds like you're kind of against any idea of competition, that you say it won't work, that going across state lines, it just won't work, or is that something you just disagree with?
Name me a Western country that has successfully relied on competition alone to solve its healthcare cost problems. The list is, I hate to be rhetorical with a host, having hosted, I understand how frustrating that can be, but the list doesn't have anyone. Now, what you have to do is you have to manage the competition the way the Germans do, for example, with their patent system on drugs, and that really is veiled price regulation. I don't think you can have a competitive market in healthcare if you also say everybody has to get health care in some way, whether it's through the emergency room or a subsidy for coverage and so forth. If you guarantee it for everybody, and so you assure demand for whatever is available in terms of life-saving and life-improving, quality of life-improving, services, then you have to regulate access and you have to regulate prices.
Well, then,
market failure.
Well, all right. So then, I know you're a big fan of what the Germans do. So then, what is the best way to move forward?
Well, the best way to move forward is to start taking a hard look at how they contain costs. How is it that they deliver health care for half the price and get better results? The answer, for example, I'll give you one example of what they do. And I'm not an expert on the German system. I'll give you one example. When a new drug comes along, they do kind of like a cost-benefit analysis on its increased benefits, and they can't charge any more for the new drug than the additional benefits over the old drug. So you don't have somebody coming out with a new blood pressure pill that, say, gives men less side effects. Blood pressure pills have that effect on men. Has some very nasty side effects. So, but there's some new drugs that don't. So you can't turn around. You can charge, say, $30 a month instead of $15. You can't start charging $300 a month, which is what they do.
So,
I mean, you need to visit a drug company's government affairs office in Washington to see lavish living. I tell my students, if you can't get the bus fare to Wall Street, visit a drug company's government relations offices in Washington, and you'll kind of get a small picture of corporate excess.
I'm sorry, but this money is a lot of it goes into the R&D.
No, it doesn't.
For these
More goes into marketing.
I'm sorry, but I've been to offices on K Street, and I find it hard to believe that the lobbying offices, the government relations office of the pharmaceutical companies and the different groups are just so much different than everybody else.
Okay,
I think that's a real overreach.
You just threw out an article of faith that they throw it into R&D. They spend more on marketing than R&D.
Well, marketing is important. I guess I don't see what the point is.
What's important is to make health care affordable to the point that government budgets aren't busting. We are spending so much on health care in the United States that we can't run our state and local governments, and we can't compete internationally. Is the marketing so important that you should have to pay $8,000 a year per person for health care while the Germans spend $4,000?
Well, so, I mean, your point is that there needs to be more government intervention into this, then.
And rationing.
Exactly. I know I'm saying things that really bug you.
No, I'm just...
They bug a lot of people
it's really
for good
bugging your
reason,
co-host. But I don't mean that. I'm not trying to start a fight. What I'm saying is that the whole justification for markets and competition is that they work better. Mm-hmm. Now, we have relied on markets and competition in the United States, and we have strong empirical evidence that it doesn't work better because our outcomes are worse and our costs are at least twice as high.
So more government intervention and rationing.
Well,
no marketing, and let's use IKEA furniture on the K Street offices for the lobbyists.
Okay, if you want to take my comments and caricature them, you're welcome to, and it makes good radio. If you want to have a serious discussion about health care, then you have to start to recognize this is an area where we have market failure. For example, we have market failure in the military. We don't have sort of, competing armies. We have a national army. We have problems with costs over there. Mm-hmm. We have problems with bureaucracy. The Europeans have problems with cost and bureaucracy, but the Europeans have more successful. This is the one thing they do more successfully than we do. Ditto the Japanese. They are much more successful at this, and they rely on less markets. They have more government intervention. The question is, can the United States accomplish that with the terribly poor public servants that we have compared to the Europeans? The Europeans have much better trained public servants.
But who in Europe do you look? I mean, do you think that England's better? Do you think that France is better?
Who should Paul Ryan be looking to as an example?
Holland, Germany, Japan.
Great. All right, Peter, always good to have you on. Thanks very much.